Welcome back to Save Your Money, Save Your Teeth, the go-to podcast where curiosity meets dentistry straight from the experts. I'm Ian, and I'm joined once again by Dr. Clifford Yudelman from OptiSmile, and we are here for the next couple of minutes to take a deep dive into the world of dental care from a consumer's perspective. Now, today, Dr. Clifford Yudelman tackles chronic dry mouth. What sparks it, how it harms your teeth and gums, and evidence-based ways to find relief and also protect your smile. So let's dive in. Dr. Yudelman, welcome back.
Thank you. And for those who haven't listened to the show before, it's not a couple of minutes, it's usually 20 to 30 minutes, so stand by.
Not much. It goes by so quickly. Because it's, So, Dr. Yudelman, dry mouth. What are the most common causes of chronic dry mouth?
So, pretty much not in any particular order. The first one that comes to mind, which we've spoken about quite a bit recently, is dehydration. From not drinking enough fluid or having too much caffeine or alcohol. This can reduce saliva production. And I've mentioned before, I think a lot of us in South Africa are chronically dehydrated. When we go to numb a patient or we're checking their teeth, their mouth doesn't fill up with saliva. It's just pretty dry. And when I was practicing in America and Australia, where people walk around with their 2-liter Avion and they're drinking water all day. And even today, we get a lot of Americans at OptiSmile, and they lie back, they open their mouth, you have a look to do a checkup, and, you need the suction standing by because they've got so much more saliva because they drink a lot more water. So, main one is dehydration, I think. And the next one is a lot of patients, my age, I'll be 65 soon. We're on, speaking for myself, I'm on blood pressure medication. Fortunately, I'm not on antidepressants, but antidepressants are a big one. And then there's a lot of allergies and antihistamines, even the non-drowsy ones. These can all make your mouth dry, especially some of the mood enhancers or antidepressants. So if you've got a dry mouth and you've recently changed medications or been prescribed medication, you can go on Google or ChatGPT and just look up what the side effects are. Sometimes you kind of get over it, and especially by drinking more water, that can help. We'll get into some other things you can do a little bit later. And the other one is autoimmune disease that's related to something similar to arthritis, and it's called Sjogren's syndrome, which is spelled S-J and then an O with 2 little uchis on it, 2 little dots above it, G-R-E-N, Sjogren syndrome. And this directly damages not only salivary glands, which leads to just a persistent dryness. It's a terrible thing. But it can also lead to dry eyes and dryness elsewhere, and it's not a pleasant situation. I have had patients who have Sjogren's. And the last one I want to mention, I'm sure there are many others, is if you've had radiation which targets your head and neck. If you've had a cancer removed from somewhere on your face, they might then do radiation, and that can destroy your salivary tissue. And symptoms appear during or soon after treatment. My late dad, he lived to almost 95, and when he was in his 80s, he had radiation to one side of his face after having some cancer removed, and he survived the surgery really well and the radiation, but unfortunately it gave him a very dry mouth, especially on the side that had the radiation. And from having very healthy teeth throughout his life up until his 80s, over the next few years, because of the dry mouth, he lost a number of old crowns and bridges, and he ended up, even though you're not supposed to have implants placed after any kind of radiation, he had very good specialists in Johannesburg, and they placed implants and were able to give him back all his teeth. But obviously then the implants don't get decay like natural teeth. But yeah, that's from a personal side. I've seen what radiotherapy or radiation treatment can do to one's saliva.
And Dr. Yudelman, how does reduced saliva affect your oral health and comfort?
Yeah, so like I mentioned, it really increases your risk of cavities or caries. Your saliva is continually buffering your any acid that goes on your teeth, and there's minerals in your saliva that are essential to remineralizing your enamel. I mean, nature is amazing. You've got calcium and phosphate and whatever you need in your saliva to stop your teeth from dissolving. So we really need saliva to have healthy teeth. It obviously makes speech and swallowing very difficult. So since saliva lubricates your tissues, it helps in your digestion. And, if you try and chew something with a very dry mouth, you just can't even swallow it. You have to have little sips of water. And we all know what it's like when you're nervous and you get a dry mouth and you can't speak because your tongue, sticks to the roof of your mouth. It's not pleasant. And then oral infections. So things like Candida, which is a type of yeast organism that's very common, especially in elderly people with dry mouths. And because it loves a drier environment without all of your saliva, which has got antimicrobial proteins in it. The worst part of it, which my dad used to get, is mucosal discomfort, meaning your mucosa or the skin in your mouth just feels like it's on fire and burning. And it's very common when the protective film or, your saliva is not only just water, but it's also it's a little bit, mucousy, and it coats everything very nicely. Yeah, we take saliva for granted until you have a dry mouth. It's all very well, having a dry mouth for an hour or two, but can you imagine having a permanently dry mouth? It's a terrible thing.
Yeah, it must be absolutely terrible.
On that note, I'm going to have a sip of water. I've got a dry throat.
Yes. Also, dry mouth is also common in people who are anxious. If you're prone to anxiety or panic attacks, that's also one of the symptoms that you'll notice. Especially, let's say you're in a public speaking environment and you have to give a big speech now in front of a lot of people. You will notice that your mouth is incredibly dry. I don't know if you've noticed this, Dr. Yudelman, but that's definitely
100%.
Yeah, and then it's difficult to talk. Then it's awful. You just want to drink something,
At least then you got a good excuse just to run away.
I would do that.
People are scared of are scared of public speaking than scared of dying or coming to the dentist. I think it goes public speaking, then the dentist, then dying, and then who knows what. Ex-boyfriends, girlfriends, ex-wives. I'm not sure. In that order.
Spot on. I also want to ask you, Doctor, which medications or medical conditions should raise concern?
Diuretics. So often people are on diuretics to help with blood pressure, or people that get swollen legs, and other cardiovascular drugs. So meaning there's different medications to help with like high blood pressure that we mentioned, and that reduces fluid volume in general in your body, and that reduces your salivary flow. Then there's neurological conditions like Parkinson's disease, where your part of your nervous system doesn't function properly, and that can impair or prevent your glands from putting out enough saliva. Another one that unfortunately is more and more common is diabetes, which affects your metabolism, and people tend to get dehydrated. They go to the toilet more, and if they're not drinking enough water, because one of the early signs of diabetes is frequently going to the toilet more often than other people around you, and also being very thirsty and drinking lots of water all the time. So if you're drinking lots of water and going to the toilet and you've got a dry mouth, that could be a sign that you need to get your blood sugar tested, and also do a HbA1c, a hemoglobin test that tells you whether your blood sugar has been too high for the previous 3 months. That's a good one to remember. And then also postmenopausal hormone shifts, which we were talking about last week. But basically, after menopause, that can reduce saliva flow over time. They've found that especially if you're not on hormone replacement. So there's another good reason to find out if you could benefit from hormone replacement.
All right, and then moving on, Dr. Yudelman, how do you diagnose the severity and source of xerostomia, if I pronounced that correctly?
Yes, so yeah, that's the medical name for dry mouth. Xero meaning dry, like Xero,
Makes
like
sense.
a Xerox machine.
Yeah.
Was like a dry. I think Xerox comes from the word zero. And then stomia is mouth. The word, it's a Latin for mouth. So dry mouth is xerostomia. That's a good one. So a medical and medication history review, which will pinpoint any drugs that cause dry mouth or systemic diseases. So that's important, to discuss that with the dentist. And then we actually can measure your saliva. I used to have in Australia, it was a very big thing. They were selling us these kits, and we had a whole bunch of tests that we could do. I'm sure there still are some dentists that will do saliva testing. We found it didn't really change the treatment very much. If someone comes in and they had a dry mouth and they thought maybe their mouth was dry and they were drinking lots of water and they were on medication, we could prove to them that their mouth is dry by doing some of these tests. So one of them is like where you chew on like a rubber band or a little piece of unflavored wax, and you keep spitting into a little measuring cup, and you see how many mLs or how many milliliters of saliva you can produce over a minute or over 2 minutes. And it's been a while, so I don't actually remember, and I haven't done that test. And then we would also once we got a saliva sample, we could do a pH test and check your pH of your saliva, and then we could do a buffering test, put your saliva on another strip that checks to see if your saliva is good quality. And there's a lot of different tests. It ended up being very expensive. One of the most common ones that I do to check for dehydration and medication is when the patient's lying back, I turn their lower lip sort of inside out. I hold their lower lip down, and then I dry the lip, and then I look. Actually, I use a microscope, but you can see it, if you've got good lighting. After a few seconds, there should be little like dewdrops forming on the inside of your lower lip. If you've got a very dry mouth, it just looks like tissue paper. It just stays dry. But if you're well hydrated and you're not on these drugs, when you do that test that I just mentioned, you'll see the saliva will start running out of the actual surface of the skin. So that's called unstimulated saliva. That's the saliva that keeps your mouth nice and moist. And the one that you get from when you chew on a piece of gum, or when you put a bit of lemon on your tongue, or you smell wonderful food, that's stimulated saliva. Even chewing on a rubber band or on a piece of wax, that the act of chewing causes your big saliva glands, the ones by your cheeks that you feel they kind of cramp up when you put a bit of lemon on your tongue. You feel that like funny feeling in your cheeks. That's your saliva glands. They're called parotids. They contract and they squirt a lot of saliva into your mouth. And there's also some under your tongue. So those big glands are all affected by radiation and medication. That's obviously something you can hear. I'm quite passionate about this subject. When we look in your mouth, generally, when I set someone back, I might, even if they haven't complained of dry mouth, if I'm doing a checkup and they're lying there for a few minutes, and I'm looking on the upper right and the upper left, and I get down to the lower, and their mouth hasn't started filling up with saliva, and I don't ask my assistant for a suction, then I might stop and say, "Oh, you don't drink much water, do you?" Or, you didn't mention any medications. Are you sure you're not taking any medications that will cause a dry mouth? And then, every so often someone says, "Oh, yeah, I just, smoked some weed, doc, I hope it's okay," or something else, that medication, prescription or non-prescription, that causes dry mouth. Also, we look for signs of fissuring or white patches, which could be candida. These are all things that we look for. And we may either refer for blood panel or different imaging, but often when it gets to that, I'll send the patient to an oral surgeon or to a periodontist that's more experienced, because, when it comes to autoimmune like Sjogren's or other diseases like that, it might take a specialist to continue with that treatment. There's also specialists. We've got a very lovely and very highly qualified one in Cape Town that every so often I find I need to send someone to Professor Joss Hiller, who's at the university, and he's very approachable. Sometimes get on a WhatsApp with him, send him a picture of something that looks a bit strange. And very, very nice professor, very great gentleman. So, we might send someone to the professor if it's something that's autoimmune. But just wanted to say.
Dr. Yudelman, what daily habits or products make dry mouth worse?
I usually recommend people use a mouthwash without alcohol, or even avoid mouthwash altogether. Any kind of like a Listerine with alcohol. Now, some of them say, contains no alcohol, but basically mouthwash can strip any remaining moisture that you have in your mouth and make discomfort worse. Smoking is really notorious for causing dry mouth. And if you drink way too much coffee, so I mean excessive caffeine, 2 or 3 coffees a day probably isn't that bad, and it's quite common. But there are people that drink huge amounts of coffee, or especially then now some of these caffeine drinks like Red Bull and Mother and you name it, and they've got other things that are got other names that are basically similar to caffeine. These can cause you to be more thirsty, give you a dry mouth, and then you just want to drink more of them. And that really messes up your glands. And if you're doing that, I recommend that you look into it, look at giving them up. And then mouth breathing, especially during sleep. We spoke about lip or mouth taping. We've done an episode on that. And we've also done one about snoring and sleep apnea. But that can make your mouth very dry when you sleep. So getting your nose checked by an ENT if you do have chronic allergies or you got polyps, maybe something's blocking your nose, but it's always better to breathe through your nose than through your mouth. Sugary or acidic snacks, they will just cling to your teeth, and you should avoid them if you do have a dry mouth for one reason or another that we've already mentioned. This will definitely increase your risk of decay. Low saliva plus sugar and acidic snacks is a recipe for disaster.
Okay, and then Dr. Yudelman, which at-home remedies provide the best relief?
So something as simple as like what I did just now, frequent sips of water. If you want to, you can even keep some water in a little spray bottle, like a little pump bottle, and you can just spray a bit of water in your mouth if you find that you can't sip water all day. Ice chips, so if you're at home, you can just sip on a little bit of ice, a little bit of crushed ice. One of my personal favorites is a sugar-free xylitol gum. So I like Orbit Professional. It comes in a little tub, a little jar, or any sugar-free gum, but especially if it's got xylitol, there's another X word. So xylitol is Xylitol. So xylitol in particular helps to prevent cavities, and the chewing will stimulate any residual gland function. A special mention about lozenges. You get these dry mouth or kind of cough drops. Now, do be very careful with those. I've had a number of patients over the years that have a dry mouth and it causes a little tickle, and they've got this sort of tickle in their throat, and they get those eucalyptus and honey, or honey and lemon. I can't remember the names of them. They just these sore throat or dry mouth lozenges, and people think of them as medication and safe, but they're basically candy or lollies, and people get addicted to them. And I've seen especially elderly people get severe cavities from these so-called medications. So really got to watch out for that. There's over-the-counter saliva substitutes. There's more and more available now in South Africa. When I moved back here 10 years ago, you couldn't get any. And now there's so many, I don't even know the names, but there's gels, there's sprays, and they mimic natural saliva. They got like glycerine in them and other things, other chemicals to make it is basically artificial saliva. It takes a bit of getting used to because it's a bit gross. It's like squirting someone else's saliva into your mouth. They do give them a mild flavor, and they're kind of oily. They coat your mouth more than a bit of water. And yeah, my late dad, he couldn't survive without some of these things. And then if you're getting dry mouth at night, maybe getting a humidifier next to your bed. So I've mentioned before, I sleep with a CPAP machine, and my machine has a built-in humidifier and a heated tube. So even though I'm breathing through a special machine to help me with my sleep apnea, I don't get a dry mouth. A lot of people are with sleep apnea or using a CPAP. They don't spend a little bit of extra money and get a humidifier, and it's definitely worthwhile. It's horrible having a dry mouth when you sleep. You wake up and you feel like you got a piece of sandpaper in your mouth.
Yeah. Also want to ask you, when should a patient actually seek professional treatment for dry mouth?
Yeah, that's a great question. So if you're getting a dry mouth and it's gone on for more than 2 weeks and you're doing some of the things that we mentioned here, I think go and see your dentist. You can start Googling any medications that you're on and speak to your doctor. Better than Google these days, I find ChatGPT works really well, especially if you use one of the more thinking models. I think it's called O3 or O4 Mini, rather than just the 4.0. If you've got the paid version and you give it a proper prompt, ask it some in-depth questions. It has a time to think, and you tell it that you want resources from published journals, not just from websites. You want proper advice. You don't want just something that I wrote on my website or some other guy down the road put on his website. You want proper medical information. That's a good tip there for people looking up any kind of problem like this. If you see your dentist on a regular basis and your dry mouth has kind of crept up on you and you don't mention it to the dentist and you go and see the dentist and they say, oh boy, you got 6 cavities. I'm not sure how that happened, because when we saw you a year ago, you didn't have any cavities. Then that should prompt you to tell the dentist, oh, doc, I've had this very dry mouth, just in case your dentist doesn't ask you or doesn't notice. And if you're getting any kind of yeast infection or candida, it's called like a white patch on your cheek or on inside of your lip, especially elderly people, that's a sure sign. And if your speech or swallowing is getting difficult and you're just finding it hard to eat or swallow, that's definitely time to seek professional treatment. And if you a person who's unfortunately lost all your teeth and you're wearing a denture, dentures really need good lubrication to keep up the suction. If you think of like you put 2 pieces of glass together, they may sort of have a bit of vacuum, but if you put a drop of water and then you put the 2 pieces of glass together, unless you actually slip them apart, you can't actually get the one off from the other. And that's the type of suction that a denture has against the upper gums and palate. And that's one of the biggest problems in older people when they do get a dry mouth or they go on a new medication. Their denture starts causing sores and discomfort. And yeah, it's a terrible situation. I don't wish it upon anybody.
Yeah, it sounds very uncomfortable. Tell me, doctor, at OptiSmile, what in-office therapies do you offer for persistent xerostomia or dry mouth?
So aside from some of the things we've already mentioned, we might make, like bleaching, we've mentioned about at-home bleaching. We might make bleaching trays, but instead of giving patients hydrogen peroxide or overnight carbamide peroxide, we would give them something that we've spoken about before called tooth mousse, which has got a little bit of fluoride and calcium and phosphate, and you wear it in these trays, and that protects your enamel from further attack. There are other more specialized treatments that we would refer you for. I wouldn't personally prescribe medication. There are medications that can boost your salivary flow, but that would be Professor Hiller or or Dr. Jonathan Dutoy, periodontist, would know more about that. And then there's a big thing. I've done some courses recently, but we don't have one of these special lasers just yet at OptiSmile. We've got another type of laser, but there's a fancy word called photobiomodulation or low-level laser therapy. And that's just where you wave a laser at a certain wavelength on the outside of the main salivary glands. And just even 30 seconds once a week they've shown that this can increase the function and the blood flow to your salivary glands. So that's a very interesting new for us, but the dentists that have these lasers might be more experienced. So in Cape Town, the main laser dentist that we refer some patients to is Dr. Brian Scher in Greenpoint, and he would know more about any type of laser treatment, and we work sometimes with him. But other specialists like Professor Howard Gluckman, a periodontist, he uses lasers for a lot of things, and he might be able to help with that. And then the other thing, which is something fairly new, and I've never sent a patient for it, but we have mentioned before, PRF, platelet-rich fibrin, and there are studies to show that in severe cases, you can get your blood taken. We spoke about this when we were speaking about osteoporosis, but you get your blood taken, spin it, remove the yellow fraction, which is the platelet-rich PRF, platelet-rich fibrin, and that gets injected back into your saliva glands, and that can sort of make them work better, to help them work better.
And then, Dr. Yudelman, how can patients safeguard their teeth and gums when saliva is actually low?
So making sure definitely that you're using a fluoride toothpaste twice a day, maybe just spitting and not rinsing the toothpaste out. In Australia and America, I used to prescribe, Colgate had something called Prevident 5000, which is a high fluoride toothpaste. I haven't found any high fluoride toothpaste in South Africa. It was on prescription, but the tooth mousse plays a big part in that. Even if one doesn't have trays made, after you brush your teeth and floss your teeth, you can rub some conditioner or tooth mousse on your teeth, swish it around, leave it on for as long as possible. You spit out and you don't rinse, you just leave it on there. There are some mouthwashes with fluoride. None come to mind. I haven't really recommended those in the recent time, but we used to get a similar high fluoride toothpaste. Getting your teeth cleaned every 3 months would be a good idea, and also to check for cavities, because you can get cavities very quickly and easily. I recommend not missing out on a checkup. And if your dentist is looking at you very quickly and he's not having a proper look, or using magnification loops or a microscope and just doesn't seem interested, you may want to see a dentist that's more specialized, or spends a bit more time, having a proper look at your teeth, because once you start getting cavities, it is terrible. They're very hard to control. It's almost like an infection, and it spreads from one tooth to another. I don't want to be alarmist, but I've seen what it can do. And sometimes we cover vulnerable areas. In kids, we do sealants, but in older patients, we can paint different fluoride varnishes on teeth, and even something called glass ionomer. It's a type of white filling that you can apply to softening teeth or root cavities, that actually has a lot of fluoride in it, and calcium and phosphate, and it can actually reverse or remineralize a cavity that's already started.
Okay, and then finally, Dr. Yudelman, what is your one best habit to prevent or manage dry mouth long term?
So thanks for that question. Yeah, I think I've got more than one best habit, but carrying and sipping water constantly every 10 to 15 minutes while we're on the water, drinking lots of water, using xylitol gum or lozenges, I think would be a good one. Reviewing your medications annually with your GP and seeing if there's any that can be switched out if they're causing dry mouth. And I think those three would be my top ones. That would be the the main things. Yeah.
Okay, and then I also believe that listeners can book a free video consultation with you if they feel that a dry mouth is disrupting their daily life.
Yes, for sure. We offer a free 30-minute video consultation. Usually that's for patients that live out of town that are thinking of coming to see us. We get patients from all over, from Langebaan, from Hermanus, even from Joburg and overseas. And we do a 90-minute in-depth digital consultation, check everything. We do 3D x-rays, we do 3D scans, 2D x-rays. We take photos, all of that in an hour and a half. Comes with a cost that's about 3,400 Rand. But some patients want to find out ahead of time, is it worth actually booking a 90-minute? What are you going to do that's different? And that's where we offer this 30-minute, no obligation, no charge video consult. I'm even happy to help people that maybe aren't planning on coming to see us. If there's an elderly person in Joburg, for instance, listening to this, and they just want to have a chat with me, I'm happy to get on a video call. We do have patients fill in their whole medical history, and in certain cases send photos, and we make them an actual patient at OptiSmile. It's not just give me a call anytime and we get on a WhatsApp video. It's a formal, we record it, we keep a transcript. In fact, if you're interested in that, listen to our podcast about video consultations. I'm always promoting one of our previous ones, aren't I?
There's so many, you know, we can just reference them all along.
Yeah. That's great.
Excellent.
This was number 72. Yeah.
Yes, that's
Looking forward to next week. We got some great subjects coming up. You'd think I would have run out of things to say, but I'm just getting more and more ideas every time. I see a patient and they have a particular question, or there's a particular, maybe something that affects their teeth that I haven't thought of doing for a podcast. I make a note and I was like, I must do a podcast on that. So next week we're going to talk about acid reflux and how it affects your teeth, how it causes tooth erosion.
Oh, yes,
so
that's brilliant.
Be sure, tune in.
Looking forward to that.
Often undiagnosed.
Yes, fantastic. It just shows you, regarding the topics, how vast the world is, the dental world. It's just, it's a very, very big world, the dental world.
Yeah, well, I'm learning all the time. I went to a course last Thursday about cosmetic dentistry and digital smile design and so on. And, although I knew a lot of the basics and so on, you always learn something. And, after 42 years, I'm always learning. And in researching some of our podcasts, I research everyone and I'm learning from my own podcast as we go as well. So
sure, that's amazing. You're teaching all of us. And we really appreciate it. So thank you once again for joining us here on Save Your Money, Save Your Teeth, Dr. Yudelman.
Thanks for having me, and until next week, have a good one.
You too, and also a big thank you to our listeners for joining us. Remember to subscribe and share our podcast, especially on the Spotify platform. And a big thank you to our listeners for listening and for being with us. And remember, while we strive to provide valuable insights, always consult with your own dental professional for advice tailored to your personal health. And don't forget to subscribe for more enlightening discussions. Join us next week as we continue to explore the fascinating intersection once again of dental health and financial savvy. Until then, stay hydrated and keep smiling.
Discover the world of dental excellence with OptiSmile. Join us for a weekly podcast featuring Dr. Clifford Yudelman, a seasoned expert with 40 years of dental experience across 4 continents. Gain unique insights and expert dental advice by visiting optismile.co.za for articles that illuminate the path to optimal oral health. If you're seeking unparalleled dental care in Cape Town, get in touch with OptiSmile or book directly online on optismile.co.za. OptiSmile, where global expertise meets local care.